All right, so we're live. And
All right.
hi, everybody. I'm going to wait until we have some viewers, and then we'll do our introductions of you guys. Hello out there, Facebook world. Tell us if you're here. Give us a hello. All right, we got one viewer. Woo!
That might be me.
You're too funny.
Hello. All
Yeah.
right, we got one viewer.
It's delayed.
Yeah,
We got four.
You definitely don't want to have that on.
No. I'm good.
All right. So whoever's watching, tell us if you're here. Tell us if you can hear us. Let us know we're good to go. Nothing. Crickets. I got crickets, people. Crickets. Give me something.
But that's okay. We're recording, so I'm sure people will see this after.
Oh, absolutely. Yep. So I just want you all to know it has stopped snowing here in New Jersey, so that's a good thing. And
we got a She-Hulk in the house.
Kind of come out.
Cindy. Who's Cindy Leach? We've got a She-Hulk.
Yes.
I think Debbie York is also She-Hulk. I love that anime. Or it's not anime, but it's a whatever it is. I watch a lot of TV.
All right, well, nobody's told us anything, so I'm going to assume that they can hear us. So here we go. We have Danielle with us tonight, and Danielle is a licensed physician's assistant, and she's the owner of Naswell RX, Integrative Health and Functional Medicine. Danielle is also a breast implant illness survivor and advocate, and she and I met back last year at the FDA hearings. And she's awesome. I call her Smarty Pants. So she's here to talk about all things health and healing after breast implant illness. And we also have Tom, and I just met Tom through Danielle. And Tom is, he's a husband and he's a dad of two, and also a veteran in the Marines. He was in the Marines, the body worker I had heard of before. He practices visceral manipulation, lymphatic drainage, and other osteopathic-oriented techniques to help find the root cause of pain and dysfunction. You're awesome, Tom. So thank you for being here. And
I never know how to word that in a way that makes any sort of sense. So if you got any tips, I'm listening.
Well, could I just tell people who are listening, so when I got sick, I didn't know why I was sick. I had the breast implants for, I don't even remember, Tom. Maybe you have some
about
memory.
A year and a half?
Well, that's when I think I explanted, but I think I met you no, it's exactly a year. It was exactly 11 months. And okay. I was in so much god-awful pain, and acupuncturists couldn't really help me at that time for me. Not that I love acupuncturists, so but she sent me to Tom, and he was able to do his work and help me with my pain, and then has stayed with me through this journey. And this journey has been 2.5 years from explant, I think roughly now. So it's
about that. 2016,
been quite a while.
I guess, is when we started, something like that.
Yeah, because December 2015, I had my implants. So I'm really excited that you're on here, because I think your demeanor, your expertise, your curiosity, because I wasn't the first person you have worked with that had implants, was, had I not landed in your office, I really don't know where I would have ended up, but because of you, I was able to gain health, gain my mind back, and then actually take action for my own health. And you've been with me the whole time. So I wanted to take this opportunity to say thank you.
Oh, well, and, you're very welcome. I'm happy that I was there, there for you, and I learned a lot, from working with you. Everybody is a teacher, and I worked with a lot of women who had issues from their breast implants. or issues, and they had breast implants, but it took me a little bit to put the two together. And I remember going to pretty much, I'd say about 75% of the plastic surgeons here in Charlotte, and emailed them or cold called them or tried to get in contact with them and said, hey, I'm seeing this problem with some of these women. I need a consult. I need somebody to talk to about this. Because I don't know what's going on exactly, and I need more information about the surgery.
And I remember thinking it was physical, not physiological.
Yeah.
And then I started to decompensate physiological, biochemically, but I didn't know it at the time. So we'll get into that. Hopefully people are coming in with some questions, but
right.
Fortunately, I'm waiting for someone to let us know if they can hear us. I've even texted a couple of people, but I got nothing so far. So you guys keep going. I think it's such a gift to have somebody who you can journey through this whole process with. So I just think that that's such a nice testament, Tom, to how much you were there to support Danielle, because as somebody who went through this myself, there's just no greater gift than having people there to remind you that you're not crazy and remind you that there is a reason to continue to fight for your own life. And there's just no greater gift than that. So, bless your heart for being there for Danielle, because we all, it's my one wish for everybody who goes through this is to have at least one person that they can know that will always be there for them. And I know that not all of our sisters, Danielle, have that. Some women don't have that support there.
Well, there's lots of, there's, anytime anybody has any sort of illness that feels mysterious, whether it's, because fibromyalgia can feel that way, chronic fatigue syndrome can feel that way, lots of different issues. I've seen, lots of different kind of mysterious pain syndromes or mysterious pains that you feel like the person who has these things, they feel like something, they know in their heart that something's wrong, but everyone's telling them that they're fine.
Yeah.
Well, they're clearly not fine.
Or
there's clearly
it's in your head.
There's clearly an issue. Right. People ask me, people say that too. Well, is the pain in my head? Well, the answer to that is yes. All pain is in your head. If you hit your thumb with a hammer, the only reason that you are able to feel that pain is because of your brain. So it is in your head, but everything's always in your head. So it's kind of one of those questions that has an answer that's, I think, a little bit complicated and can be a little bit deceptive too.
Yeah. And Tara, my hope is that, I need to put a year on it or a month on it, but we should be able to go to a practitioner and have them not say, yeah, I got you handled. And then you give them $1,000 and then you're not handled, right? Like if I have any decree or any stand, like I want to train practitioners to be able to know what this is, recognize this, do X, Y, and Z, and get us on the road to health. Because it shouldn't take us 2 years to get healthy. I am healthy today. And I kept thinking along the way, oh, yay, I'm here. And then I'm like, not. And then, oh, yay, I'm here. And then I'm not, right? Like, and now I can't wait for the day where, I still take some supplements, but I am mostly, well, I wouldn't say mostly, maybe 50-50, right? Like food to supplements. Like, I don't think we need to live on supplements. So if you're going to a place, initially, I don't know how to do it any other way. Like if you're deficient, you can't raise that bar by food, right? In my opinion, in my experience with this. And healing that gut is not as easy as like, oh, I gotcha. Take a sauna, take a coffee enema here, take a little, selenium or slippery elm or whatever it is. Like it's more complicated to that. And then that, and if you have a practitioner that is just like, oh, I got you, but it's going to take you, 150 times every 2 weeks, and every 2 weeks is $500. We need to talk. We need to do something different. That should not be what your healthcare is like.
Yeah, I agree.
So here's the deal, everybody. For some reason, nobody's comments going on. I've got text messages that comments are coming in, but they're not showing up. So 3 of us are going to have to be real creative and just look for us. Just talk
well,
about
what's
it.
really, it says, can you explain what Tom does? How does it work? So let's talk about lymphatic drainage, because I think, Tom, for me, and when I see clients, and it's not only detox, right? But it's flowing, like lymph does hormones, I'd love you to take it away and talk about what you do.
Sure,
and
yeah. So the lymph in the body, the lymph is the water system of the body. So you have a vascular system that carries the blood, and then you have a system that carries around the water. And in that water, there's lots of different things. There's bacteria, there's cellular debris, there's toxins, there's things that the body needs to take care of. Yeast, it's also the system that transports nutritional fats. There's also more research into the system that says it's part of the hormones, as far as the dopamine, serotonin, transportation of those hormones. So that's research that's kind of going on right now. There's lots that goes on inside of this system, and one of the things that the breast implants does is it squeezes off and changes how the lymph flows inside of the chest. It changes the direction of things mechanically because there's now an object there in the way, and the body has to figure out how to navigate around it while it's creating scar tissue around it as well. Now, all of this lymph in the body, it comes to really one place on the left side inside of the collarbone right here. So you'll see a lot of women, they'll have more congestion on the left side of their body. There's not really a duct that's as prominent on the right side in most people, but it's mainly on the left. So so when the implant is there, it is squeezing off these vessels that allow lymph to flow into the correct places in the body. So there is backup in places. There's flow changes in places. There's been really interesting research on this, and there's an osteopath out in England, a guy named Raymond Perrin, who talks about CFS, chronic fatigue syndrome, and how lymphatic changes cause the brain not to be able to detoxify as well as it should, and that there's also the possibility of a reverse flow of lymph coming from the brain. That's what he talks about, and if you can change that flow, then the brain can detox freely like it's supposed to. Symptoms of that could be brain fog, mood changes, hormonal issues, all these things that we see in chronic fatigue syndrome, but that are also present in the breast implant illness community. So.
Yeah, so there are a couple of questions. You guys, if I'm looking down, I'm actually trying to read the post that you guys are doing. And Cindy Leach, let's see if I can find you. It says, I was diagnosed with asthma last March-ish due to a severe silicone rupture. We didn't discover until mid-October. I'm still dealing with it, not as severe, but do you think it could possibly be permanently damaged? My rupture was the worst my surgeon has ever seen, and probably leaking in the chest, ribs, lymph, nearly a year at least. Let me jump in on this real quick. I am seeing a lot of silicone rupture implants that they didn't know they had a leak during them being implant, but on explant, and that's why we really do our best to promote N-block. If you don't know what N-block is, we'll describe it a little bit more later. Just put the questions in so Tara can know, and we can either answer it in the thread or now, but instead of spending time on that, there you go. Technology at its best. But so this is a I would say first it started as I want to call it a pet peeve because I can't think of anything else right now, but there are many women in the same predicament. And I've seen, for some, it's been a long journey, Cindy, and some it's been a short journey. And there are things to do. And I said, there's things to do from a functional medicine point of view and a biochemical point of view. And there's a big thing to do from a movement point of view. And Tom can speak to that around lymph and sauna and heat and these silicone structures that are within the implant, depending on what implant you have. They're all different molecular structures, and I forget if it's the higher number or the lower number that is more negatively charged, become a little bit more gummy bears, blah, blah, blah. But they can stick to things, but that doesn't mean they have to stay there. And even if they become adhered to the different organs and stuff, like you can still obtain optimal health for sure. So I don't know if you're hearing me on this, but there are people out there to help you. And I'd love to know where you are. And Tom, take the lymph drainage from here.
I believe Cindy's in Texas.
What's that, Tara?
I believe Cindy's in Texas.
Oh,
well, come to Charlotte. Tom and I are in Charlotte.
Well, there's lots of good folks in Dallas and in Austin that are good therapists there who know lymphatic drainage. So,
in Houston, Bahije.
You know somebody there?
Well, the Chickley people. Well,
yeah,
we'll
the
hook
Chickley
you
folks
up.
are in Texas. Yeah,
we'll do our best to hook you up, Cindy. We can't promise everything, but
yeah. So I know that the silicone that gets trapped is getting out of the body because we've seen it leave. We've seen it flush from people. We've seen
through the skin.
Through the skin, it'll come out. And if the body's fluid systems are not moving like they should, then it's not going to be able to push things out like it should. But I think, instinctively, you have people who have different reactions to different substances. So someone over here on this side of the spectrum could have like a really severe reaction to silicone, and someone over here can have not as much of a reaction, and their body could be able to take care of it more quickly. So you're going to have people who on a spectrum can take care of it more quickly than others. And I don't think that there's going to be any sort of blanket like this is exactly how the body is going to get rid of this silicone, because your individuality is going to dictate some of that, and just some of that knowledge isn't out there yet. So
yeah. And in October, we're hoping to have a meeting of the minds, a summit, if any of you guys are listening are practitioners or body workers or whatever, it's a meeting of the minds to figure this. Can I say shit on Facebook?
Yes, go ahead.
It doesn't matter now.
To figure this shit out, because we don't know. Like, I would love to tell you, like, oh, all my patients are totally fine and totally healthy, and but we work through the journey together, and each one is different. And at some point today, I'd like to talk about the trauma behind it as well, right? And the reason we got implants, and the reason and working the mind, body, spirit part of it all, and the physiology of it all, and the structure of it all. It's not just one thing. So there's someone else, Tara, way up on the list. She asked about I think hold on, Tom, Kira loves the green trees and the birds singing.
Thanks. Me too.
Christy, amen, right back at you. Robin Tout, hey. She's wondering how receptive the plastic surgeons were to you.
Oh,
Tom.
That's great. So I got nobody said anything except for, I got crickets except for one. One place was like, sure, I'll be happy to talk to you. And I said, okay, great. And this was via email. So I was talking to the PA of a surgeon in town, and I'm not going to tell you who it is. But
I want to know.
Well, I'll tell you
don't
later.
do it.
But yeah, I said, okay, well, let's just start off with these questions. So I talked about structural issues as far as shoulder position. I talked about, the anterior tilting of the scapula, the rounding of the shoulder forward. I asked about that. I asked about pain. I asked about some surgical procedures as far as for where, if you guys hear something that sounds like a duck quacking in the background, that is my dog hanging out with a chew toy.
I wasn't sure
go.
it was the chair.
That's my dog. Sorry, no, that's my dog.
I thought you had a duck.
He's just, that's, yeah. So that's,
Sorry, this is awesome.
go get it.
He's
All
like
right,
snorting.
so,
I didn't know if it was
right.
gas.
So what are you gonna do? All right. So yeah, and I asked about half a dozen questions or so, and then did not get any response at all from that. I didn't get "we'll get back to you." I didn't get anything. Nothing.
Yeah.
So nobody wanted to talk about it.
Tom, do you have a good rapport with any like plastic surgeons or a bunch of plastic surgeons in your area? How are you received with the plastic surgeons near you?
Well, really, my only rapport with plastic surgeons is through Danielle.
Okay.
To be honest, I've had contact with other plastic surgeons who have done other procedures type of things, because I also work with things like diastasis recti and women who've had abdominal plications and all sorts of different abdominal surgeries. You are hilarious right now. That's my dog. But those surgeons have been very receptive with other procedures, but with breast implants, not so much, except for Dr. Cortez's has, and the guy in Charleston, who is Cortez's fellow. His name is
Granston? No,
some.
he's. I'm blanking.
Okay.
I'm blanking. He's good. Cranston. It's Cranston.
Yeah, Cranston.
Yeah.
Or is it, or something like that?
There's another question. It's by Mary Meyer Johnson. I suffered from one implant for 35 years. Explanted October 2019. Several symptoms went away, but they all came back very disappointing. And Mary, there's, while I'm not assessing or treating you in this, right? Like, this is a common complaint from people. Tara, same for you?
Yeah,
Yes.
The rebound.
Yeah. Well, and I don't know that it's necessarily a rebound. I think what I would love to know about Mary is, like, did she go back to eating normal or the typical American diet, or drinking wine every night and things like that? Not like bad, but as in an assessment tool, because, like, we don't know why we have GII, and it is an assumption that like our methylation, our detoxability isn't as easy or as fluid as it could be. I know that I relapsed at 3 months and maybe 6 months, or like there was some N in there, and each relapse was maybe not as in magnitude, and then it would die down and go on. But at some point I was left with this foundation of, like, when I went in for explant, I thought I was 80% better, like, that night. And I felt fantastic, but I still had to walk the straight and narrow with diet or no exercise, or, like, I had to be very mindful about every friggin' thing and take so many supplements and have such a routine and sleep a certain way. And oh, God.
Well, and later we also found some different things with you, which was, somewhat recently, about the fact that you had some silicone still in some places in your body that they saw on the.
Well, I don't know that it was silicone as much as it was a fluid capsule.
And then you had the seroma that was there.
The seroma, for sure.
And, I think and those were causing some nervous system issues.
Oh, yeah. Can we hold that thought for a minute? Because in the clients that I,
no, go ahead.
Because in the clients that I see, not everyone has a seroma or silicone, and I don't think I had silicone, right? But this is common, Mary, for this to happen. And there's a biochemical pathway issue, maybe a metal detox that needs to be done, maybe a yeast thing to be investigated, maybe a Clostridia to be investigated. Like there's like these breast implants are, I'm going to simplify and say there's plastic. I'm sure the off-gassing is worse than BPA, right? And so that's going to change our hormones. That's going to make us maybe more estrogen dominant than we typically are. And you may need some more progesterone and all these different things. So there's that. Then there's the microbiome. Then there's the endocrine cascade, right? And so we've got to get those back in line, let alone rewire the neurological system, right? And I think, Tom, for me, detox-wise, lymphatic-wise, liver-wise, visceral-wise, especially if you have silicone in the body, that can make things very similar to scar tissue and hold things in place, right? So to help that.
Well, also with, I'm sorry, I interrupted. Go ahead.
Oh, no, that's okay. But so there is, and not every functional medicine provider, which I'd love to say is find a naturopath, find a functional medicine provider, but not everyone has that bandwidth of knowledge base, right? And it's not just about genetics, because it's the expression of genetics. So how can we turn that off? We can, right? So how do we optimize methylation? How do we optimize this? And I don't know if we answered your question, Mary, but there definitely is hope. And, it's a journey. It definitely will be a journey.
And if I could add to that also, just a little bit, the lymphatic flow changes inside of us after surgery and during surgery. So you can have a reversal of lymphatic flow, let's say, that I was talking about earlier, into the brain, and that flow doesn't reflow and doesn't go back the other way without a little bit of convincing, without a little bit of therapy. So you can have those things. Not that that's the end all be all or answer to everything, but it's definitely a piece of the puzzle for lots of folks. So,
what can people do at home to help with their lymphatic system? Are there things that people can be doing at home?
So there's lots of different things to do to help. One of them is deep breathing. And I see a lot of folks who are breathing wrong. And I see a lot of women who've had breast implant illness who have also had bladder issues and have had some sort of pelvis issue that kind of corresponds with it. And I think one of the things that's happening is there's a constriction of the rib cage because of the implants. And it's causing, when the person breathes, they're not expanding their rib cage like they should. What they're doing is they're breathing outwards in the belly, but the rib cage is squeezing inward.
Right.
And forcing pressure, forcing the abdominal contents into the pelvis. So the diaphragm is connected on the underside of the rib cage and all those places. So if that is constricted, you can't go in and out like that. You won't think to, because there'll be too much resistance. So the breathing and allowing that rib cage to expand is going to be part of how your body controls lymph inside of the abdominal cavity, which also will help lymphatic flow throughout the rest of the body. So deep breathing is a big thing. And you got to make sure you're getting your rib cage big. A lot of people who are doing like deep breathing exercises, they're doing something that they're calling belly breathing, which isn't diaphragmatic breathing.
Right.
It's breathing where the stomach is going out like a bowling ball, and then the rib cage is squeezing in. So check yourself if that's how you're breathing.
And one way to, sorry, I'm going to try to, I don't know if I could do this, but one way I do it is I'll hold here as my chair spins, or I'll try to even hold in the back and make sure I try to push my hands out, like.
Yeah.
And yeah, so versus.
Or you could also hug yourself like this and put your hands on either side at the bottom of the rib cage there and feel your hands expand back and forth that way. It's kind of the same idea that Danielle was talking about. But
you can push off from the back of the floor or the wall. Yeah.
And what about rebounding or dry brushing? Do you recommend any of that as well?
Yeah, rebounding on the jog. I like
Well, I think the rebounding is okay, but I think you got to figure out where you are inside of like post-surgically before you start jumping up and down on a trampoline.
Of course, yeah.
And I have to say, for me, dry brush, God, I hope this doesn't cause backlash. I do the dry brushing. I've done the rebounding. I don't have as much success with moving my lymph as I do when I'm eating right, making sure I take my hydrochloric acid. And I literally, even if I do it too hard, I'm moving it up towards the heart. I'll start from my foot all the way up to the heart, right? I'll make sure these are open first. I'll tap, you can't screw it up. Tap it, hit the kidneys, and just, or just massage all the way up. Just get things moving. I don't think you really can't miss it up.
Yeah, you're not going to be able to out lymphatic drainage yourself out of a bad diet or bad nutrition. If you're eating dairy and you're not supposed to be eating dairy, it's going to make you puffy.
Inflammation.
It's going to cause inflammation. Alcohol is going to cause inflammation.
I have to say,
too much sugar is going to cause all these things are going to cause lymphatic issues. I know, right?
Tom, we're going to have to mute you. But
I'm telling you.
I'm kidding. I know. I studied that for years.
I know. I just want you
let me just wait. Let me wait. I just want to say something. So, Tom, I know Tom and I don't know each other so well, but most people know that my worst symptom with breast implant illness was horrible cystic acne, and I've told Danielle that I don't sweat, and I certainly don't sweat on my face.
Yeah.
So now I can tell that I have under. That is, you can't hear me?
Say that one more time.
Okay, so can you hear me all right? I don't know.
Yeah, I can hear you good.
Okay, I have a lymph node under here that swells up real bad when my acne is bad. Mm-hmm. And my acne is not so bad, it goes down. And after my surgery, when it was an appropriate time, I started doing the rebounding. And I can tell you that after, I forget how much I was doing, 5 minutes twice a day or 5 minutes a day or whatever it was, lymph node actually go down. Actually, it was responding to what I was. It was so incredible. I didn't keep up with it, but the couple times I did, I saw a difference. It was very interesting. I know my lymph system is a huge problem for me just by all of the symptoms I have.
Well, another hidden lymphatic system issue for a lot of folks is going to be an autonomic nervous system dysregulation. So here's what that means. So we have this background software that's running all the time called the autonomic nervous system. And it is one of the things that governs the lymphatic flow. So it governs this pulse that causes the lymph to go through the vasculature that it needs to go through. And it's also part of the system that responds to stress. So if there's dysregulation in that system, then you're going to have lymphatic drainage issues, and it could be stress related. And I mean emotional stress.
And just stomach inflammation stress, right? And
stomach inflammation stress, right?
And that can also affect your breathing and the pelvic floor and all of that. I mean, it's a cascade and not just one.
It's a multi-system issue, especially if the autonomic nervous system is involved. You mentioned
it is involved in BII. It is. I mean,
it always is. It's
so
really.
if you've got brain fog, if you've got any of this, it is involved. Like you're in sympathetic overdrive. If you've got a yeast issue, a Clostridia issue, if you have acne, if you have leaky gut, if you have anything like that, your sympathetic is on overdrive. And your parasympathetic is doing whatever it does. And so how do you down-regulate that sympathetic overdrive and up-regulate the parasympathetic and meet here? And that's why you have to... Oh, sorry.
How do you do that?
It's for me, and I hate to say this, it's different for everybody, right? So if you know you're go, 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 and you're driven, and you're push, and your advocacy go, and you can't turn off at night, and you're not going to sleep, and you're texting like your best friend, and they're like, I need a moment or whatever, like that's overdrive, right? That's like, that's, if you can't shut that off, your parasympathetic is a little bit too quiet, or your sympathetic's a little bit too high. So you've got to get to know you, get connected to your body, whether that's through yoga, meditation, sweating in the sauna. We digress a little bit. I'm going to shift for a quick second. The best way to detox is quiet sweating, and that's in the sauna. And if you can do yoga if you can be yoga and breathe yoga and be in hot yoga and feel it, then that is quiet sweating. But if you're doing it to do it, to get the definition or to sweat or to do that, then that's not being yoga and getting all the philosophy in there, but sitting in the sauna, right? That's parasympathetic sweating. That's going to detox you. The running, the doing the CrossFit, that's going to burn methyl
that's
groups.
not going to do it.
No, and that's going to deplete you and deplete your adrenals. And so I can't answer that per se, but if you can't calm down and you're always spinning, then that's a conversation. And for me, what that was dealing with so many things of my past, and that's the trauma conversation, right? And by trauma, I mean wounds that haven't healed, right? And keeping this BII, why did I get breast implants? I didn't want to feel like a boy anymore. I was 48. I finally had a six-pack. I thought, you know what? I'm going to get a rack. Worst thing for me that I could have done, right? But there must have been an insecurity or inferiority, or I wasn't good enough, or I wanted to be better than. And I'm still exploring all that. So I don't have the full answer for me. I can't imagine if I had breast cancer and then wanted to get implants, or not wanting to get implants, but feeling like I needed to get implants to feel like a woman, right? Mm-hmm. Like you have to deal with those onslaughts, those wounds, those conversations. And what brought us there was a lifetime for me of 48 years of choices, thoughts, and whatever that I need to be with. And I honestly think this year, dealing with all of that's what's brought me to my nth of better health now. Like I wanted to have these conversations with everybody last year, but I didn't feel like I was healthy enough. And now I totally do. And so there's that, like, why did I get implants? And then, God, geez, the shit I went through when I said, I got these implants and now they're making me sick.
Yeah.
So I was wrong. I nearly killed myself, and now I've got an explant, and people are gonna know. Like, what the fuck? Oh, excuse me.
I guess you can say that on Facebook too.
Apparently, bleep. But that's the truth of it. That's the truth.
And the financial burden of the whole thing, and the emotional burden placed
financial.
Mm-hmm.
And you can bring that easily back to the autonomic nervous system, because that is all trigger things for the autonomic nervous system. The feeling of shame, the feeling of isolation, the feeling of loneliness, the feeling of not belonging, all of those
not being believed.
Emotions, not being believed, not being heard, not being understood, all those
All
things
of life's main things. Yeah.
Are part of a healthy autonomic nervous system. So there's a place in this definitely for other types of, for not just medicine and manual therapy and things like that. There's a place for going to a talk therapist or a psychotherapist or whoever is, your choice for trying to get your mental health squared away. So that component could be even a part of the temperature issue or the lymphatic issue,
But I don't think, and I'm going to be real pissy here, because I don't think that at that time, if you said, like everybody else had said, go see a therapist, or you're just depressed, or you're no, like there's a physiological basis of it as well. And I hear you, Tom, but coming from a BII perspective, like it's not just that, and you don't know it when you're in it. So like one of the things that you taught me
I agree with that too.
Is the edge thing. So even like if you're on the massage table and your massage therapist is working with you and they're like, is this too painful? And you're like, just get the job done or whatever. Like, what is your edge? Like, do you know you? Do you know your body? Do you know your emotions? Do you know your feelings? I think these are things that will bring us all, no matter if you have BII or autoimmune or whatever, to the nth level of health. But I don't know if I segued that really smoothly, but yeah, it's really hard to hear and have someone tell me, "Oh, go see a psychotherapist." When I don't know that at that time that would have been.
Well, I mean, I think it can be framed in a way to where people understand why that's part of the solution. Because if you look at it in a way to say, there's you're having a physiological reaction. That physiological reaction is causing mental stress. And that mental stress is also something that needs to be dealt with. We could take away the physiological issue, and if that were gone, the mental stress and the emotions around it is still something that needs to be dealt with in a compassionate, warm, caring way. So
speaking of which, if you guys, if there anyone listening, there's a couple of books to read, and for me, one that set me to a moment was When the Body Says No by Gabor Mate, and When the Body Keeps Score. Is that
The Body Keeps Score?
Is Vander Kolk?
Yeah.
We can put it in the
Vander Kolk.
Yeah.
Like
we can put it in the comments later.
Yeah.
And for me, that brought a lot of like aha moments and relief too. Like I feel like I took care of the physiologic first, and this past year has been taking care of the emotional consequences of life. How's that?
I think that what we have to remember is that can you hear me? That
you broke up.
Okay, we don't become sick all at one time. So every system becomes sick at a different time, at a different rate. And so when we're healing, we're going to heal at a different time, a different rate, and not every system can heal at the same time, correct? So this whole process, you have to take into consideration how long you had your implants. And, maybe you had your implants 10, 20, some women 30 years. You're not going to get better in 1 year. You're just not. And I think that needs to be said more often, that the heal is very real, but it also takes a really long time sometimes. And you're going to have to dig deep into the early parts of the emotional shit that you had to go through in order to get implants, whether it was because you chose to or because you had to deal with breast cancer. All of those things you have to take into consideration when you're going through this healing process. So I think it's just such an important thing to recognize that this is such a whole body healing. It is not just one system or one part, right?
Right. Yeah. It is not. It's never one thing.
Never
ever. It certainly isn't with this.
Yeah.
if I could say for anyone, like learn how to nourish yourself, mind, body, spirit, right? And by body, eat healthy, eat clean, take out the toxins. That includes what you put on your face or soak your feet in or swim in and that kind of thing.
Mm-hmm.
And then nourish your mind, enrich yourself, be creative, or do your best to be creative. Like, don't, judge yourself for it. But, and then, enrich your mind, find your passion, find I call it juicy juice. And spirit wise, find what calls you to be. And that's what I would say to do. And versus, if you call me, I might say, hey, let's do a Dutch test or an organic acid test or something like that. But at the end of the day, those are the three things I think that you look at yourself, get to know yourself, you'll heal yourself, right? Tara, what do you suggest for people? And Tom, will let you go last.
Yeah, I mean, I would say absolutely the same things. You have to find one or two people that you trust in order to help you go through this whole process of healing. And, because there's going to be a whole bunch of people who say, oh, try this and try that. And like you were saying, Danielle, before you know it, now you're going through all this blood work again, and you're trying supplements, and you're spending all this unnecessary money. And
wait. Sometimes these tests are important, but I do think the foundation and the grassroots are more important.
I agree. But if you're just spinning your wheels and not looking at the root cause, not doing the correct testing, that's the key, is not doing just any testing, it's doing the correct testing. And you need to find somebody who's going to look at your whole self, not just one particular system, and want to test for that one thing. And I love your approach, Danielle, and that's why you're one of my go-to people, because I trust you and you look at the whole body, and I absolutely appreciate that. So I think you've got to find one or two people that you trust. You have to dig deep, and you have to put yourself first. I think that's not always the easiest thing to do. Most of us are moms, and we work, and we have all these things going on, but putting yourself first is okay, and it's not selfish to self-love.
Even if it's 5 minutes a day, right? I mean, seriously, there's got to be some end for you in the day. Even for the Toms of the world, there has to be some time for you, and you get to create what that looks like.
Yeah, absolutely.
Mm-hmm.
Go ahead, Tom. Your turn.
I think that the most important thing for anyone to try to figure out when they're sick is their sleep.
Oh, yeah, that's a good one.
And their relationships. So you have to be able to sleep. And you got to figure out why you're not if you aren't.
Agreed.
You got to put that on top. Another thing is how are you socialized?
Or not.
Or not socialized. All right. How are you socialized? Meaning that you could not be socialized. How are you socialized?
Community.
What relationships do you have that are helping you? And what ones do you have that are contributing to your problems? You can't move through something this difficult without support and without love and without rest. You're just not going to do it. It's going to be much more difficult.
I tell you, there's so many women without support, Tom. And that's why there's so many awesome communities like Tara's Northeast BII group, Nicole's big group, the Carolina group. Like, find the support. It's out there. And you may have to take your last ATP, which is energy, right, to go and look for it. But we're here collectively and individually to support and advocate for us. So if you do feel alone, join one of these groups. There's somebody that wants to give back because, like it just is. It's like a Peter Paul or mentor-mentee situation. So I didn't mean to interrupt you, but there are unfortunately so many women doing this alone with their husband sitting right there.
Yeah, stress will derail anything.
Yeah.
And you're going to be, I was in the Marine Corps, and I went through, I was in 9/11. I was in Operation Enduring Freedom. I was in, those things, and there's a lot of stress involved in that.
Maybe
and I can tell you that stress, and everybody has their own stress and their own plate, but stress will derail any good intentions. You can eat perfect, you can exercise perfect, but if you're not taking care of your mental health and your stress in that way, you can derail anything. So,
yeah.
There you
go. We might have to do another one, Tara.
I know, right? I mean, we have a question. If you guys ended, we can come back and do this another time if you want, or we can go on. It's up to you. We've been up 50 minutes, so it's up to you two.
I mean, I'm fine. Let me go check on my kids real quick.
Okay.
Go for it.
My phone sort of died that I was trying to search for people's questions. So
okay, I have it here. I was going through. I do have some more on that stuff, but I'll wait until Tom comes back.
I'm a lymphatic specialist too, Tara.
Well, I didn't want to talk about it without him. I felt like it was nice.
Okay, Tom can answer. He's cuter. Let him do it. That was probably like what hazing.
Patricia was asking, can you share some of your specific testimonies on how you've helped women with their health issues, increasing the flow with the lymphatic system and the removal of toxins and the removal of silicone?
Was that for me?
It
or
was.
For Danielle? Okay.
I think it was for you.
See, that's not fair. See, Tom made me go get lymphatic training and all this visceral stuff. He didn't make me. You inspired me to do it. So,
I mean, I've seen, I don't know how many women I've seen who've had breast implant issues or breast implant illness. I'd say I'm probably over 100 at this point.
Mm-hmm.
Most of the women that I've seen see me because they are in pain post-surgically, or have some sort of other problem post-surgically. That's why they end up in my office.
Post-surgical implant or post-explant?
Well, actually either, but recently it's been more post-explant.
You're welcome. Just kidding.
Right. I have like probably a smaller group that who have implants and who are in pain and end up in my office because they have pain and they don't know it's from the implants. And then I'll have probably a larger group who have lymphatic issues and will have pain in their chest or have headaches or pelvic issues, bladder issues, scar tissue problems, keloids,
right?
Any number of things.
Yeah, I would say 2 out of 10. I've only seen 2 women. So of the implant women that I get to work with, there are probably 2 that don't have upper lymphatic issues. They might have lower, but that's probably more due to like pelvic floor tightness and hips and stuff. But many people have lots of lymphatic issues with implants.
Right. Danielle, did you want to talk about Andrea's question with
Nope.
women? It's the question that scared me. So women with cancer who explanted, do you see a lot of continued flare-ups and inflammation? Is it because their body is fighting 2 different inflammatory responses at the same time? She left us some specifics on her case. But I don't know if you want to just speak to some of what she was.
Yeah, I think the flare-up is due to inflammation, period, right? Not being able to, is just, I'm going to just categorize it as inflammation. But, you know, there's a lot of things that can be bucketed in that. Now, when someone has cancer, there's a lot of inflammation or dysregulation just because of that, right? And so now you have inflammation, and, you know, now you have a different disease process. And so the body just can't keep up. So I don't think it's just that. The people I see have the recurrence of the BII or inflammation, and not just because. Now, when the cancer recurs, that's a different conversation, or a different, depending on what cancer, genetic pathway, and things like that, right? So, and when things are metastatic, the body's dealing with a fullness, you know, head to toe, a systemic inflammation cascade. So it's not just that. And if a person can't deal with the silicone floating through their system, and now they have autoimmune symptoms, and they have leaky gut, like it's not the same cascade, and each person's going to have to deal with it differently, but it all is under the inflammation heading. And so in her case, I would say it's the metastatic cancer that is the foundation of the inflammation. So what can you do to get it all down? Or if you have 5 different places you know are on fire, how can you keep them not in flames like Australia, right? So you work with a practitioner to dampen, and sometimes we go for low-hanging fruit, because if you can go for the 5 low-hanging fruit, then you only have this amount of fire. Like, it just really depends. And that autonomic nervous system that Tom was talking about, that can do more than I can do. So literally working through, whether it's called compassionate inquiry, or getting to know yourself, or somatic experiencing, or craniosacral, or even lymphatic and fascial manipulation can also help with that too. So
I think there's did she mention what treatment she had for the cancer? Did she have radiation plus chemo, or?
She has shared with us she's had a lot of treatment. Danielle, do you remember? I don't know if
I know she's done. I don't feel. Yeah, I would rather you read it from her. Like, I don't.
Well, regardless.
I mean, but I think she for sure has chemo, and like, if you have chemo, like, that alone is its own cascade.
That's
right?
its own thing, right? Yeah. So you have lots of different, you know,
and so I
that you're dealing with.
Asking specifically, like, you know, like, does vitamin C help? Does all this stuff? Like, there's different things that can help your immune system. There's just like with the coronavirus, right? Like, getting rid of your inflammation and your oxidative stress is a big deal. Beefing up that immune system with vitamin D and zinc and C, sunshine, and, you know, lowering that stress and sleeping, like, those are going to be your big things. If you have diabetes, hypertension, like, get those under controls. That's lifestyle stuff, right? And when you can't, you take the meds, right? If you're on an ARB, talk to your doctor and see what you can bob and weave around that. So.
Right. Yeah. I know she does a lot of all that, and I think she even does the IV vitamin C or the liposomal. I'm not sure, but and that was how I wanted to end the whole discussion, was, Danielle, the oxidative stress discussion. You know, like, people what oxidative stress is, and different ways that they could maybe support their immune system and decrease the oxidative stress that they have in their bodies.
Yeah. So, and sometimes, not in the functional medicine world, but sometimes in the outside world, inflammation, oxidative stress get combined, right? And for both of them, really, lifestyle changes are a big deal. Like Tom said, sleep is humongous, right? Decreasing stress. And stress to me is not just like, you know, I used to think I'm listening to the birds chirp there. I used to think it was just emotional and like, oh, deal with your emotions, right? That's before I knew what my edge was. But you need to, take the downtime, take the you time, take the, some people say meditation and yoga. I go in the garden, or I just try to zone out in the sunshine. And then I'm killing two birds with one stone, right? So in the morning I'll go in the sun, expose as much skin as I can. And in the evening, I'll do that. And that helps me with my vitamin D, because I don't orally, when I take D3 or K2, like my D values don't go up so much. But when I'm outside in nature, it'll jump up really far, right? I do take, and I say it for me, like because I can't prescribe things for you, right? I'm not assessing you and I'm not treating you. So for me, I also take zinc and I take vitamin C, and I would prefer to get all of this through food. And so I need to make sure I'm digesting. And if I'm not digesting well, I can't absorb, I can't break it down and I can't absorb it. So for me, I take hydrochloric acid and I take some pancreatic enzymes, right? And I know I need to do this because I've done some testing. And I'm saying all this just to protect myself liability wise, right? And all of that will, I'm trying to think if I leave something out, will boost my immune system and every now and then I'll take a multivitamin, but I don't take it every day, because sometimes for me, and because I have like a plus minus MTHFR, sometimes I'll get edgy on the B vitamins. So I'll decrease that. So I don't take that every day. I really check in with myself to see what I need. And I do love doing what they call an organic acid test every now and then to see where my biochemistry is going, right? So I don't know if that fully answers your question, but it safely answers it for me.
Yeah, that was perfect, because I think it's all good information for everybody. So I think we should probably wrap it up. Do you guys have anything else that you want to share or discuss before we go?
One thing that I'd like to share is that I know this is very much an emotional time for someone who's going through this journey. And it's emotional for lots of reasons. And it's something that you definitely don't want to ignore. So make sure that my dog's barking at me as he's having a lot of emotions right now. He wants to play fetch. Make sure that that is something that you're in tune with and something that you're trying to work on and improve. And don't be ashamed of it. Be okay with it. Don't try to be awesome at everything. Just try to be okay. There's so many people trying to be awesome, and it'd be much better if they just were trying to be okay.
That's very true. And I think that I don't even know what I was going to say. Go ahead, Danielle.
For me, I would say that I might be opening up a can of worms, but if you're already working with someone you trust, but they don't know about BII, I'd be glad to schedule a call with them, and talk with them and guide them. We need so many more practitioners out there that, that's just important. And then from having breast implant illness myself, you're not crazy. It is real. The FDA recognizes it as real. That was a big stand for us and a needed. Soon insurance will recognize it as well. Explant and block if you can. And if you are rebounding, there is hope. We've just got to get you to the right, navigate you to the right practitioner, navigate you to what you need for you and feed you on your journey. And only now, 2+ years out, am I appreciating the journey. So it will come for you. Just stay on the road. So.
Absolutely. And how can people contact you? Can they just message you through Facebook, or do you want to put a link down in the comments?
We can do, you could do I can put my phone number, I can do my Facebook or Navwell on Instagram, through Tara, through Tom. You can reach Tom through me or through Full Body Function, Tom?
Yeah, that's my website. And then Instagram, I'm Body Worker Tom.
Yeah, so let's do this, folks. And then pay it forward.
Right. The more people know all this information and can share it, the better, so that it's not just a few people pumping out this information to the masses.
Oh, God, yeah.
I feel like this is exhausting for you, Danielle, in particular. A lot of us rely on you for a lot of information, and you have twofold. You've got the information, you have the empathy because you've been through it. So, it'd be nice to.
Let's do it. Let's get it.
Awesome. Well, thank you both so much for doing this. I really think it was great for so many.
Thank you so much for having me.
Of course, I'm so great with the question. Thank you guys.
Take care, Tara. Take care, Danielle.
You too.
Thanks.
Bye.